Health can no longer be a single discipline. Everyone knows it. Nobody's arguing about that one. It's interdisciplinary. You cannot solve the health problems by knowing one specific information, one specific skill. You have to be able to integrate your skill into the rest of the health profession.
The University of Massachusetts Online Masters of Public Health program is a 100% online master's degree program.
We've had a long history of online education, one of the first fully online MPH programs in public health practice.
It is fully accredited, and it is specifically designed for working professionals and those who have at least 3 years of experience in public health or healthcare.
I'm currently a staff nurse in inpatient cardiology.
I started volunteering with Boston Healthcare for the Homeless at Mass General.
I'm also a lieutenant commander in the United States Public Health Services.
I am a registered dietitian.
I became the environmental health director at the health department.
I am a pharmacist by training.
One of the great things about our program is that while it's fully online, you do have really good interaction with your faculty and fellow students.
We have faculty who have taught for 12 years in our online program. They really come from all over the country.
You have the opportunity to work with other professionals in the field of public health or healthcare.
There was one class where I had a missionary in Indonesia and a missionary in Africa. They actually took us on a whole journey. They just went on a dialogue between each other, but the whole class followed it. The professional public health degree, you have to take your experience and bring it to the classroom. So everybody learns about who you are, everybody learns about what you do. It's an incredible experience for us all.
One of my students was a WIC nutritionist, but she's in Alaska, so she's all by herself. She doesn't have anybody to really work with that's a nutritionist. By being in the program, she gets to feed off of other people's ideas and ask questions, and it's also nice for dietitians and physicians to see what each one does.
I worked full-time. I had this little 3-year-old boy, had a husband, and researched online degrees, decided that this degree program, because it was accredited, ended up deciding that this was the right place for me.
I'm sure everyone is busy, in this day and age. 2 teenagers. I really don't have time to just go, and sit in a classroom.
Working full-time, it's really great to be able to go to school from the comfort of your home.
It was perfect. It was flexible. I could still work and even apply what I was learning to my current position.
Online, I can do this at my own pace. I can still multitask and get my life in order.
I was very nervous when I entered, not sure about how an online degree program would work, how I would do, how the interaction with the other students and the instructor would be, but it was absolutely fantastic.
One of the nice things about online teaching is that, if anything, it actually raises the level of classroom discussion, which sounds a little counterintuitive because you think, how can you have a classroom discussion? But the way online teaching works, you have these threaded discussion structures. Because people are really writing out their classroom participation, it forces people to think a little bit more clearly, to be a little bit more disciplined. And in fact, the interaction and engagement is often more intense and vigorous than you get in a classic classroom situation.
They really encourage you to take something in your workplace or something in your community and work on it with people who can actually help you implement it so that you're really seeing the real-world applications of what you're doing.
I researched a couple of other programs, and I didn't think that they provided quite the same level of coursework and the same experience that the professors had compared to the programs in UMass.
Personally, I think the best thing about our online program are our students. We have wonderful students. If we're getting high ratings from whatever accrediting society, it's because they're sending out surveys to the students, and the students really come back.
The faculty really enjoy working with our students, and they really want you to succeed and will help you. The Master of Public Health degree really can open so many doors for you. If you're a career changer, you're been working as a laboratory technician, and you feel like you really want to go and do community health education, really it can help get you there.
The UMass Online MPH program is fully accredited. It's 100% online, and it's just a fabulous program to become involved with.
I would definitely do this program over again if given the choice. In fact, I was kind of disappointed I finished up before I had a chance to take some of the electives.
If I had the chance to do it again, I would absolutely attend University of Massachusetts Amherst and the online public health practice program.
There are just so many opportunities in the field that the MPH degree can really set you up for that quite well.
I can't tell you how good it feels to meet them at graduation and say, this was the best thing I ever did.